So, welcome everyone to this free question and answer session on the Family Health course. My name is Dila Maria, and I'm overseeing the courses at the Mayo Academy, and I will be your moderator for the session tonight. I'm very happy that we are here with the course leaders, the outstanding experts of the Family Health course. My dear Dr. Manohar Palakurti, a globally respected Ayurvedic physician with over 30 years of clinical and teaching experience. My dear Manohar worked directly with Maharishi Mahesh Yogi for 3 decades and helped integrate Ayurveda with modern physiology. Vaidya Manohar is currently clinical professor of physiology and health and director of the Maharishi Ayurveda Panchakarma Center at Maharishi International University. Welcome, Vaidya Manohar.
Thank you. Thank you. Thank you.
Thank you for being here.
Mm-hmm.
And Professor Dr. Bruno Renzi is a medical doctor and psychiatrist known for bridging modern medicine and Ayurveda. He is a specialist in holistic mental health and stress-related disorders. Also, he's co-director of the Maharishi College of Perfect Health International, former professor of Maharishi Ayurveda and Integrative Medicine at MIU, the Italy Master, and author of The Mind in Ayurveda. Welcome, Professor. Yes. Did you reconnect? I think, Hanu, you may have to make Dr. Bruno and Lorenza co-host again. We may have had to reconnect them so that you can open your microphone.
Yep.
Yes, and also make them co-host. Yes, okay. Now you can open your microphone.
Thank you. Thank you so much. So we are here. Thank you. Thank you.
Yes.
The...
Welcome, Professor Renzi, and with you, Dr. Lorenza Gargetti, trained at the University of Milan and globally certified in Maharishi Ayurveda. Also a former professor of Maharishi Ayurveda and Integrative Medicine at MIU, and co-director of the Maharishi College of Perfect Health International, teaching health professionals worldwide. And especially as a pediatrician and Ayurvedic expert, Dr. Gargetti is especially dedicated to the health of mothers and children, coordinating training for physicians in integrative pediatrics across Europe. So thank you both, and thank you all three outstanding course leaders for being with us.
Thank you. Thank you to all of you for being here with us during this meeting.
Yes, so welcome every one of you who has connected from around the world today to this special session where you can explore what this family health course is about. And we would like to ask you to write just like a sentence or a few words in the chat what brought you here to this session today. We would love to hear from you, so you can just open the chat and say what brought you here to this session. We'd love to hear from you. Yes, you're writing where you're from, really from all over the world, from Lebanon and Mexico. But why did you come to this session? You can also write in the chat what brought you in this session. We can just take a moment and wait to hear from you. Curiosity from Italy. Yes, that is a good reason. A good basis to learn. Any other reason why someone is here? Yes, now we're getting a lot to hear about health-related discussion. And Christopher says we're here because we are soon opening a Peace Palace and want to offer this course. We want to have a deeper understanding of health at the family level. Yes, very good. Grace says, I have learned a lot about Ayurveda as an individual, but I'm very interested to know more about the family perspective. Yes, and asking questions. Very good. Thank you so much for sharing. So perhaps let's dive into some questions that you already have submitted when you were registering. And at the same time, while we are discussing here, you're always welcome to share more in the chat.
Yeah.
But may I start with a question to Dr. Gargetti on the topic of modern families that are facing so many challenges these days?
Exactly, Lila Maria, exactly. During the last decades, families all over the world have had to face so many changes, so many challenges that have been putting a great pressure to the family as a whole, to the family as an institution. And so this is why we decided to program a course especially dedicated to family health, in the sense that this course will take care of the family as a whole, but at the same time will be able to give us some knowledge about the different needs of the family members. Because just to give you a very simple example, for example, a diet that could be very good for a 3 years old child may not be so good for an elderly person. And so in this course, we will be giving indications and knowledge in a very systematized way, according with Maharishi Ayurveda, regarding the different aspects of our daily life, regarding diet, regarding physical exercise, rest, sleep, and so on. But we are going to give all those advices by taking care of the different needs of the family members. So here the main principle, which is also a very important principle in Maharishi Ayurveda, it is to protect the unity, the well-being of the family in the diversities of the family members. So unity and diversities at the same time.
That is very beautiful. And also just now in the chat,
Yes.
Alejandro said that he's here to have a healthy family physically and mentally. Perhaps also, Dr. Renzi, you would like to comment on the mental aspect. Will that also be covered during the course?
Yes, in the second section of the course, we have free lecture about the mental health, and so we will offer practical skill and also some indication to understand the way in which the mind work and different mental state, internal representation, and how the people can use this knowledge in the relationship in the couple or with the child, and just the relation between the father or the mother and the child. And so to know how the mind sometimes change different internal representation, and they can use this practical skill. And at the same time, we will offer some integrated knowledge how to treat a simple condition of stress that is something that is continuously present in the family, so we can create more balance and unity and harmony inside the family relationships. And so we will offer all this practical knowledge, theoretical and practical knowledge, and at the same time, all this knowledge is offered in an integrated way. We will offer knowledge from modern medicine integrated with ancient knowledge, Ayurvedic knowledge.
Very interesting. Thank you. And following up on that, Dr. Lorenzo, you had mentioned about, children and elderly. Vaidya Manohar, may I follow up. Somebody had asked a kind of concrete, practical question for more advanced in age, for example, how to gain weight or how much to exercise, or whether it is all right to do panchakarma when one is elderly and maybe has never done it before. How would such questions be addressed in the course? And is there anything you can say about that now?
Yeah. So this course is designed for everyone, including children, married people, parents, grandparents, all like three generations: grandparents, parents, and children. So now the question is grandparents or elderly people, how to help. Panchakarma is one procedure, but in Maharishi Ayurveda, we discuss about behavior, routine, diet, harmony with the environment, close and distant environment, and collective consciousness. Elderly people are the pillars of, they are the foundation for the collective consciousness. They can integrate family easily and then help the family and all the habits and dietary habits, behavioral habits, and also routine and communication skills and emotional sharing and different aspects of because they are experienced in all these skills. So also, their role for family health will be discussed in the family health course. Panchakarma for elderly people is very essential. According to Ayurveda, 1 to 30 is Kapha age, 30 to 60 is Pitta age, above 60 is Vata age. Vata age is a very important age because it is prone to degeneration. So, how to prevent that degeneration? Especially this degeneration starts from the senses, sensory organs. Sensory organs are five, from eyes, nose, ears, skin, all taste, tongue, all these sensory organs, how to rejuvenate them. And motor organs. Motor organs means pani, pada, payu, upastha. Pani, pada, hands and feet. Walk, speech. And then payu, upastha means reproductive organs and excretory organs and their functions, proper balanced function. So the sensory organs and motor organs prone to some degeneration because of vata. Vata quality is change. It is always moving and changing. So how to balance this vata in elderly people through these five concepts: behavior, diet, routine, and physiology is panchakarma, but harmony with environment, close and distant environment, that is vastu and jyotish, and collective consciousness is samuhika chetana. So, as I said already, they are the basis for the foundation for the collective consciousness. All these principles will be discussed in the course.
Very beautiful. It's a beautiful way to put it, and to honor every member of the family in a way in their role. That's very nice how you put it, and also to know that it is very holistic, how every every aspect, every question is considered. Very interesting. Thank you.
Yeah, thank you.
Now, Dr. Lorenza, since we're talking about family health course, coming from the seniors in the family to the younger ones, we received many specific questions, I'll just summarize a little bit, and then you can see how best to address it, like is being a single parent good or bad for the children, and how to help an addicted son or daughter with specific issues, and how to protect the children from radiation, from all the electromagnetic and Wi-Fi fields and all of that when they're in school. So many questions like that that parents have, how to make their children most, happy and most healthy. How will that be addressed in the course? And do you have any points now that we can take away?
Yes, for sure. You mentioned, dear Lila Maria, so many important aspects related to the different ages of childhood. But here, the most important thing to be clearly understood that in this course we will learn the most basic principles. We will learn how to adapt to every single member, every single person of the family, to adapt the main rules according to Maharishi Ayurveda in order to be healthy and to keep a good health. So this requires, this is the great skill of Maharishi Ayurveda, I think. It requires a very personalized approach. In modern medicine, we are used to cure the disease. We are used to cure the imbalance. So we detect as doctors an imbalance, and then we give some drugs, some general indications. In Maharishi Ayurveda, the procedure is completely different. We have first to take care of the constitution of that person, of that child, for example. We have to take care of the age of the person we are curing. And not only that, we have to take in consideration the environment where these people lives, and the season of the year, so important. So many diseases are really influenced, deeply influenced by the season, and also the different daytime. So this is a kind of very well systematized program in order to teach, to learn all together how to adapt all those different aspects to a single member of the family. So we don't cure, I would repeat myself, a general imbalance. No, we have to put this imbalance in the context of the life of that person. This sounds maybe a little bit difficult, but actually it is not at all, because Maharishi Ayurveda is based on the laws of nature that governs not only our physiology as a human being, but the whole universe. And once we learn these basic laws, we will be able to take care of our personal health. And then I stop myself. I just wish to add that in modern medicine, there have been so many researches in the field of how to prevent serious diseases, chronic diseases, and this can be achieved by teaching to people an appropriate lifestyle. And from the perspective of Maharishi Ayurveda, the lifestyle should be personalized. And this is exactly what we are going to share with people regarding diet, regarding physical activities, regarding, as Dr. Bruno Renzi said, emotional aspects that impact so heavily our daily life.
So that is a very hopeful context, actually, that while we have so many specific questions right now, about specific disorders that we or somebody in our family may have, but you are saying we will learn, we will be empowered by you as teachers, as course leaders, to understand the cause of the symptoms. Like the specific imbalance is a symptom, and we will understand the cause and not just run to fix the symptom, but also make sure it doesn't come back. So that is very helpful. Now, a follow-up question, perhaps for Vaidya Manohar, and then we'll have for you also, Raja, Dr. Bruno Renzi in a moment. But for somebody who may already have taken some course on Ayurveda, could you explain how this course is specifically for families, how it is different from other Ayurvedic courses we may have attended before?
Yes, good question. So everything is consciousness. Even though you have 10 members in the family, but only one consciousness, but in 10 people. So consciousness-based approach to health is similar to Ayurveda, similar to family health, similar to the children health, similar to the elderly people health. So what I'm trying to say, consciousness is the foundation, fundamental, but all these simple principles, specified principles to each family member will be different. But the foundation in this course, what we try to explain to you, how to maintain that foundation firmly, and on that you can build on specific steps. But what is the difference in the Ayurveda course and here? There are some specific knowledge of each lesson related to the family members. Specifically, this is for elderly people, this is for children, this is for women, this is for men, and this is for parents, like that. So Ayurveda is more on Vata Pitta Kaphas and tissues, Agni, Srotas. This is the knowledge in Ayurveda, but not necessarily a generalized information in Ayurveda. Ayurveda is very specific and study material, and then try to understand what is mind, body, consciousness, senses, and different aspects of the physiology. That's Ayurveda and the holistic approach. And here also, holistic dynamic approach, but based on, again, consciousness, the same principle work for everyone, and also specific principles for each person. Maybe not completely discussed in Ayurveda, but it is in Ayurveda, but people not attempted to discuss those things. In this course, first time, we're going to attempt a specific beneficial points or knowledge to catering all the family members.
And so you're basically saying it is holistic and specific at the same time. And only
Correct.
with Ayurveda you can do that, because that is quite amazing.
Correct. If anything is specific, and it has to be holistic. Without a holistic, nothing. If any part supposed to be from the wholeness, so parts of knowledge always comes from the foundation of wholeness of the knowledge. Ayurveda represents the wholeness of the knowledge. Ayurveda represents the parts of the knowledge.
And does it also mean that whether somebody knows about Ayurveda already or has not heard about it before,
It
either
becomes
way,
much
this
easier.
will be interesting because it is applied to, all different members of the family. So that makes the course very different from any other course, right?
Correct. Also, already some people may be taken some Ayurveda courses. For them, it is much easier for them to understand what we are speaking, what we are recommending, why they are recommending. For them, it is easy because they already know the principles behind Ayurveda is Vata Pitta Kapha. Even though here specific principles are given to all the family members based on this Vata Pitta Kapha. Even psychology also Vata Pitta Kapha. Diet also Vata Pitta Kapha. And routine also Vata Pitta Kapha. Everywhere Vata Pitta Kapha. They are the bio principles and how to utilize in different age groups and in the family and collectively or specifically. That is the specialty of this course.
Thank you so much. That's very helpful. And please, everyone who is listening, if we haven't reached your question yet, or you have a question that comes up, please do write it in the chat. Any particular question to our course leaders. Dr. Bruno Renzi, from a modern medicine perspective, there's still several questions that have come, how Ayurveda and modern medicine works together, and even are you aware that there may be some ingredients in some Ayurvedic remedies that may be contraindicated with some medications that somebody has been prescribed and is taking? Is
Yes.
is that being addressed?
But in my experience, especially in the field of psychosomatic, I use the integrated approach. I use many multimodality approach from Ayurveda integrated with modern medicine. Generally is the Ayurvedic preparation are so soft and so they don't have side effects, and in mostly they can use very easily and then can be integrated with the proper attention and dosage. Also in some imbalance condition of the different of the patient. It depends obviously from the pathology, from the condition of the patient. And as Lorenza said, always we observe the prakriti, the constitution of the person, and the vikriti. So, and from that point, we decide a program that is related to use of Ayurvedic product or daily and seasonal routine, some specific diets, some specific application of Vedic sound therapy, and all this. It's a very soft approach that can be easily integrated with modern medicine. And the best thing is just that the doctor, normal doctor, they need to have some knowledge. They have to be prepared in the field of Ayurveda. So they have to they need to have a good formation in the field of Ayurveda. And so they can easily integrate the modern medicine and the Ayurvedic medicine, and to observe continuously, because it's a process. It's not something that, like in the modern medicine, that you have some symptoms and then you use some preparation. It's a process in which you very slowly modify the physiological balance of the person. So you start just a journey with your patient, in which slowly you modify his condition from a pathological or from a condition of imbalance in a new reality that is more balanced. And this to do this, it's necessary time, but it's easy. This is my experience, that because I use it also in the hospital and at the university, the integrated approach, it's easy to integrate Ayurvedic medicine with modern medicine.
I think that is comforting to hear, because sometimes, in some serious conditions, somebody has to take something, and we got some questions, is that very bad, or is that then a contraindication to Ayurveda? And you can say, we can still do both together. And even if we have to take some medicine, we can still get support from Ayurveda at the same time.
In my experience, Lila Maria, I think that it is really essential to create a kind of a collaboration between the Ayurvedic doctor and the regular doctor, let's call him this way. And it is in this cooperation that the patient can really get a lot of benefits. For example, what we have been experiencing is that by using Ayurvedic preparations, you can reduce the dosage of chemicals, let's call, of drugs. And this is very important because we all know that many drugs, especially when we use them in the context of chronic diseases, might have a very serious side effects. So the less is the dose of drugs, the better is for the patient. This is another very important point.
And I wish to add another thing, that when you use modern medicine, normally it's a biochemic action. When we use Ayurvedic preparation, we are using biophysics action, because the laws were just the action of the Ayurvedic preparation. It's a very, very deep in at the level of physiology, at the level of the dosha. And so it's a different modality of action, but with a good experience, you can integrate very well the two approach. And as Lorenza said, it's important because you can reduce this dosage of modern medicine and slowly just change the state, the physiological state of the patient.
So just to clarify on the questions on, specific medications, or in the chat we also have on vaccinations, if our doctor recommends something, then in this course would we say, don't take it, or take something Ayurvedic instead, or would you say continue to go by your doctor's advice but get healthier, and then your doctor's advice will change? How will the change happen?
Probably the second option. So I think that we are the main doctors of ourselves. This is another important principle, in the sense that we are the very first person who is able to feel, to detect that at that moment there is kind of a imbalance, no? In your physiology. And so it is important to know how to restore this imbalance. So we have to be able to understand, according to some main principles, as I said before, that this may be, for example, an imbalance mainly related to Vata. Now we are in winter, the weather is so cold, so it's so common to have Vata imbalances. So I know that, I've learned that. So what can I say in order to restore the problem? Of course, I will also probably need to go to a doctor if the problem is getting serious, but nevertheless, the main purpose of the course is to teach people how to learn a personalized lifestyle for them. In modern medicine now, we know for sure, as I said before, that just to avoid, just to reduce the great risk about chronic diseases is to have a good lifestyle. And this lifestyle should actually start very early in our life, during childhood, or I would say even before childhood, even during pregnancies. This is another very important point for Maharishi Ayurveda, for Kamarabritya. So I think this course will be a very practical system in order to take care of ourselves.
And the indication will be for all the different components of the family. So for child, adult, grandparents, mother, father, different roles inside the family, how some emotional condition also inside the family. And if you have some practical knowledge, you can solve some, you can understand some communication problem that it's one of the most important problem in this moment between parents and children. But if
Yes,
you have some
probably in every generation.
very little knowledge that can help you practically how to change your disposition and how to change your communication.
This is very exciting. And so from what we have heard just now from both of you, I think every one of us who's connected here, if we are not already, because we are all family members at some age in the
In a way
family.
or another, we are a family member.
Yes.
Yes.
But I just wanted to emphasize what you both said, that this is the very first course, I think, that we have had on Maharishi Ayurveda specifically for families. So also if we have friends or our children or grandchildren have friends or who even are thinking to have a family, or who are pregnant or who have young children and maybe didn't have the time because of that even to attend today. This is a very, very interesting, very essential knowledge for that time of life also. So we can share that this course is available, and we come to in a moment to the practical things. If you can't attend every session live, that's not a problem at all, but you can still sign up and have the knowledge. So please, let's have that in mind. But I wanted to come back, perhaps Vaidya Manohar, in a moment, because we heard about lifestyle and how important that is. Now, actually, we received several questions that I know I should eat healthier, or I know I should do this, or have a good lifestyle, go to bed early, get up early, but I don't manage to do so. Will I feel bad during the course because I will get to know all the things I should do, but I somehow don't always manage to do it? It just, I get lost in life or something. We had questions like that. Will it also help me to find ways how to more easily do what I know I should do?
That's why family health course. The family health course is a collective consciousness. Okay, my brother is doing, he's feeling good, he's more intelligent, he's more creative, he's more healthy, he never complained any cough, any cold, any congestion, or he never complained. My mother never complained, aches and pains. My father never complained, no sleep. This is what the family has to feel, the collective health. This is called collective consciousness, how to enliven each family member to feel the perfect health, the holistic dynamic nature of health to experience every family member, so that if any family member is not experiencing a good health, then it's very much easily influenced by the healthy people, and then so that they can follow very easily. By saying that, I'm going to quote one saying from Mahabharat. It says, Janami Jnanami Dharmam Nachame Pravritti. Jnanamya Dharmam Nachame Nivritti. Kenapi Devena Hrudistitena Yatha Niyukto Smita Tata Karomi. This is an expression one of the king informs to the people. Very famous Sanskrit verse, often attributed to this king Duryodhana. His name is called Duryodhana in Mahabharata. What it says, I know what is right, but I have no inclination to do it. I know what is wrong, but I cannot abstain from it. I do helplessly what that something sitting inside me prompts me to do. So here, he doesn't know what is influencing him to do right thing, not able to do right thing, and not able to refrain from doing wrong thing. He doesn't know what is influencing. Maharishi makes a comment that is what is called collective consciousness. If collective consciousness is not, greatly enlivened, and that these things happen. So that's why the whole family course is make everyone feel good health, so that it contributes to the other family members, even though they are not inclined to do the right thing, but they know this is the right thing, but they can do it. But when whole family is doing, the collective consciousness will change the shift in consciousness, the shift in awareness. Maharishi says health, consciousness-based approach to health is self-help, self-help. The self is going to help them because they are going to come back to the self, and so that they will gain total health. That is through the collective consciousness of a whole family, not mother, not father, not brothers, not sisters, not grandparents, everyone together. They will do it. So that is what is important.
Thank you. I think you really got the question by your answer. That was, I think everyone who asked a question in that direction feels understood.
I will be back. 1 minute.
All right. Roger, Dr. Lorenza and Dr. Bruno, on that consciousness side, somebody was asking in the chat, how is TM introduced in the program? And perhaps you could also clarify, is it a prerequisite to take this course to be a practitioner of transcendental meditation?
No, it's not a prerequisite. I also wish to emphasize that this is the very first course, Lila Maria, for the general public. We are used to give courses for doctors or for health practitioners, but this course is meant to give a program for general people, I mean for every one of us, but from the knowledge of Maharishi Ayurveda, we know very well that health is based on consciousness, because all the laws of nature that govern our physiology are based in the so-called unified fields of all the laws of nature, which is within us, which is our self, the big self, the Atma. So it is very important, in order to promote health among a family, to teach people how to get in contact with this level, which is a transcendental to our daily experience, but nevertheless, which is the real root of our existence. And so this is why, especially Manu Arji, who is a great expert in this field, we will give knowledge about the meaning and the role that a transcendental meditation plays in health. There are plenty of studies now, hundred studies that testify how important is the practice, the daily practice of transcendental meditation, in order to reduce and to cure, I also would say, many diseases. For example, cardiovascular diseases. We know that this is the very first cause of death, especially in Western countries. And now it has been definitely showed that by practicing transcendental meditation, we can really reduce the risk of many different cardiovascular diseases. So it is important to understand, and we will teach that health is based on consciousness. This is a very important Maharishi Ayurvedic principle.
And we will have just one lecture totally dedicated to transcendental meditation,
Yes.
because it's absolutely important that and just to explain to the people how to you can create coherence in your mind and also balance in your physiology through the regular practice of transcendental meditation. And there are, as you know, there are many scientific research that show all the positive effects of transcendental meditation. So we will have one lecture dedicated to transcendental meditation in the field of mental health.
Beautiful, thank you. So basically you're explaining and covering, the mental part through mental techniques, and the physical parts to physical approaches. And somebody said in the chat also that it was very heartening to hear your full explanation about how Ayurvedic medicine can be used alongside Western medicine, so it is not contraindicated. And Vaidya Manohar, somebody had commented basically on what you were saying, but even before that, if it is possible by improving one's own health, one can also contribute to the health of the family. And you mentioned that. So thank you for all those many answers. And we would like to ask everyone who is connected now again, would you like to take a moment and think what would make this course a success for you or your family? I'll put the question in the chat also to everyone. You could think a moment and write, and then we can cover. There were some practical questions also on the course. Perhaps we could ask while you're thinking, and we come and see your answers and read them in a moment. Perhaps we could ask our MEO course host, Hanu Sika Ahu, to share the information page on the course, and then we could get an overview of all the topics that will be covered that may be helpful. And Dr. Lorenza Gargetti, would you like to go through the topics, perhaps?
Okay.
Okay, so just to give you a simple view of the main topics we are going to cover during this course. We don't want to enter the specific topics for each lesson, but just to give you a glimpse, I would say. In lesson 1, we will talk, Manoharji, Dr. Vaidya Manoharji, will talk about the consciousness-based medicine and the role of parents. In lesson 2, we always, Manoharji, will talk about the family unit and the unity and the collective well-being. And then we will talk, I'm going to talk about diet, digestion, and balanced nutrition according to the needs of the different participants, of the different people of the family. Then Bruno, Dr. Renzi, will take care of a very modern and important, especially among teenagers, aspect of their lives, which is exercise and breathing. Then yoga for health and immunity. Sorry, there is a chat that is covering. Okay. And also, of course, daily and seasonal routines. This is a very important aspect. And then we'll have disease prevention and detox, mental health and family relationships, taken by Dr. Renzi. Then sleep and restoration, sleep and rest, main principle. And pregnancy and child health. This is my favorite topic. And then preventing lifestyle-related diseases. This is yes. These are the main topics we are going to cover during the course. The course will start on the 8th of February and will last on the 29th April 2026. We'll have 11 sessions.
Thank you very much for that overview. Somebody is asking, will the entire course be pre-recorded or live?
Oh, this is maybe something you should answer.
I think the question is, will you actually be there at every course
yes,
session,
yes.
or
Sorry,
is it
no,
something you have
no.
recorded in the past?
Sorry, Lila Maria, I didn't understood the question. No, of course we'll be there. It's a lively course, absolutely. We'll be there to explain, and we'll be there to take questions and answer and give answers about the topics we will give out during each lesson. No, it's a lively course.
Each lesson is about 2 hours, and we will have 1 hour and 30 minutes of knowledge, and then we will have 30 minutes for questions and answers. And it will be all live, and the course participants, they have the possibility to review also the lessons, and they have this good possibility just to hear again the same lecture.
And I also wish to add, Lila Maria, that we love to be very flexible in a way. So, if just to give you a practical example, let's say there is a person who followed the lesson, and then they didn't ask during this lesson, during this meeting, but then after a few days, kind of question comes out in your mind. So they are absolutely free to ask again in the further lesson. So no problem in the next lesson.
It may also be that one starts to apply what one has learned in one lesson, and only that brings some feedback, either question or positive feedback, that maybe one wants to share in the next lesson. Is that possible?
Absolutely.
Yes. So just to clarify, Dr. Lorenza Gargetti, Professor Bruno Renzi, Vaidya Manohar will be there live for the sessions. And it will be wonderful if you can be there live as a course participant. But if as a course participant, sometimes some lesson, you're not able to be there live, or even if you're in a time zone where it is very difficult to connect at this time, then every lesson will be recorded. And let's say usually like about 24 hours after the lesson at the latest, it will be available online. You will receive a login. And then you can even go back and watch a previous lesson because maybe you have a question, oh, that was discussed in a previous lesson. And then you can go and listen to that. So it's wonderful that we have such great experts live and we can always come and ask you questions. But also the archive, the recordings will always be there. One more question someone was asking, will it be mainly lectures and questions and answers, or will there also be course material? I don't know what it means. Maybe it means charts or something that will be shared.
At the moment, we don't have any course materials, but they have the possibility just to see all the slides in the recording, and so they can. That is a good material.
Exactly. The slides will be actually the course materials, and all those slides will be available for 3 months after the end of the course. So the people will have plenty of time in order to review, to re-elaborate, to take some notes, these kind of aspects.
Wonderful. That makes it very easy, I think. Hanu, may we ask you, there were some questions on translation. Now we have Spanish and Italian live translation for this session. Will there also be translation for the for the course that is starting on Sunday?
Yes, at the moment we have at least 2 languages will be translated. We will see if there will be more requests for other languages, and then based on how many people need translation, we will set up translation hopefully in this short time.
Okay, thank you. That is a great service. And also the translation will be recorded, right? So even if
every language tracks will be recorded, and then every different language versions will be uploaded to our course platform. So next day they would be available already after the evening session.
Wonderful, thank you. So there is the link in the chat to the course landing page. And if you go there now, it will just click on it. You don't have to read it now while we were still talking, but if you click on it, it will open in your browser and you can read it later. And then you can click on the button to, to register. And you will see, it will ask your country, and the price depends on your country. So if you're, in a less economically strong country, the price will be lower. That is very nice. And also you can see if you apply for part 1 and part 2 together, you get a discount. So it is worth considering that. But then also you will see there's some in the application where you can choose that you will need translation in one language. So when you apply, then please choose that. And we already know that many have already, applied and paid and asked for Spanish translation and some for Italian. If sometimes there's only one person asking for a language, then we will talk to you and see if it is necessary or if we can afford to find a translator. But it is in the application where you need to mention the language that you desire, and then we will try to make it happen. All right. We have some more practical questions, but also we are reaching the end of this session. So I would like everyone to think for a moment. First of all, if there's anything we haven't mentioned on the practical things, I think we need to mention that the last day to apply is day after tomorrow. Today's Wednesday, so a Thursday, and on Sunday the course starts. So even if you apply on on Saturday, the day before the course starts, it is all right. But if we need to organize translation, better you apply right away. But you can still share with friends the same link that we have just put in the chat to spread the word now that you know more about the course. Yes, and I think there are no more practical questions. Except how often will the full course be offered? Just once a year or more often? I think it depends on the demand. It is the very first time that is being offered, so it is you will be pioneers by participating for the first time, because as we heard from our expert course leaders, normally this knowledge was given as training to midwives or nurses or doctors, and was more professional training. And now it is for parents and grandparents and those who want to be parents and anyone who is always a member of a family. So yes, we will see how that goes. And I think thank you, Dory, for also reflecting, that you say I need to restore my balance on every level. And others were saying the elderly don't have so good sleep, the children don't have so good, very young children, babies don't have so good sleep. So there's demand for everyone. Would you like to share what is your main insight, takeaway from this session today? Just a reflection of what was useful, what is your takeaway, your insight, your reflection on the session today. We'll just take a moment and wait until you write in the chat. You can just also in the chat. integrating Ayurveda and modern medicine, says Diane. Thank you. I need this course. Yes, I think everyone does. Such a great course to be offered to the general public. I think the need is definitely there for this knowledge, and the response from the community could be very strong. Beautiful reflections. Thank you. Any more? You may be typing. It always takes some time to type, especially if you're on your phone now, so then it may take longer. Embodying the knowledge you're radiating. That is to you, Vaidya Manohar and Dr. Lorenzo Gargetti and Dr. Bruno Renzi. Yes, we definitely have that feeling. There was already great knowledge available tonight. Thank you very much. The upcoming course, when it is recorded, maybe it could be offered in the future, possibly without a live component. That could be possible. That it's the recordings later on could be on demand, but then still some live sessions with the doctors and Vaidyas. I think that is always very useful. Oh, maybe a last question. There was somebody asking if they like to have a consultation by a Vaidya and there's no Vaidya nearby, is it useful even to have a consultation on the phone, even if they cannot feel the pulse? Is that also a possibility? Vaidya Manohar, what would you say?
Yes, Vaidya Manohar.
Yeah, I think it's all up to you. If you decide it is okay to do, and that's fine with me.
All right. So I think we had a very lively discussion tonight with all of you who have connected. So I think the big thank you goes to all of you who are connected. Otherwise, we would have had a wonderful tea party among the course leaders. But thank you, everyone, for connecting from around the world and bringing all your questions in the chat and then the registration before, and for wanting to make your life and the health of your family better. Thank you for having that desire. I think that is the right starting point. And please feel free to share this opportunity with others by, just sharing the landing page of the course with all your family and friends. And don't worry, whether they are meditating or not, whether they are interested in meditation or something specific or not. Everyone is interested to feel good, to be healthy, to be strong in life. So I think this course is for everyone. And yes, thank you, Michael, for reminding. Thank you for our wonderful translator, Sarah, who has been translating into Spanish, and Teresa has been translating into Italian. And would you like to give any closing remarks? Perhaps we start with Vaidya Manohar.
Thank you, Leela Mariaji, and organizing this course and giving opportunity to do this course. So special thanks to you. Mainly, my suggestion for everyone: prepare for prevention. Ayurveda is for prevention. Heyam dukkhamanagatam, about the danger that has not yet come. So that is the fundamental principle of Ayurveda and also this course. The therapeutic approach, restoration of balance, and also treating diseases, all these things are there, but we will give some education on it. But the whole course will be very beneficial for you. How to prevent, suppose some emotional stress in the family, how to prevent it, how to become unified function, like that in every aspect of health, how to handle, how to apply the principles of prevention, from diet to the exercise to the behavior to the psychology to the consciousness based approach, all multi-modality approaches, how to implement, how to integrate. The main principle is prevention. Keep it that in mind. It is very beneficial, for prevention. Okay.
Okay. So a big thank you to all of you, and especially to Lila Maria, who made this course possible to be done. This is very important because during the last months, she has been supporting and helping us so much in the organization of the family health course. So thank you, dear Lila Maria.
And we are very happy that we can offer for the first time this knowledge to the general public, is not only to doctors. And we will use a very simple language, understandable language. And we are very, very happy to start with this initiative inside the Meru Academy.
Yes.
And thank you, Lila Maria. Thank you for all your support. Thank you.
Yes.
Thank you for your love for families and for the health and well-being of everyone in the world. And we're looking forward to meeting again with you and hopefully with all of you here now on Sunday for the first lesson of the course on family health. So thank you everyone for joining and see you again on Saturday. Then it will be half an hour earlier at 7:30 in the evening Central European Time, the first lesson on the family health course this Sunday. So we wish that you will all stay very healthy and join us in celebrating health for the whole family starting on Sunday. Thank you for joining. Good night.
Thank
Have a
you.
nice evening and sleep too.
Thank you. Check it.
Good.